There's Mary.
Okay, do y'all hear me?
Yep.
Okay.
And we are live.
Okay, I'm gonna call the meeting to order. Board of Trustees meeting, August 10th, 2025. It's 4:35 p.m. Public School Retirement System of the City of St. Louis, 3641 Olive Street, second floor boardroom via Zoom. We'll start off with the roll call.
Christina Bennett. Candace Carter Oliver.
Present.
Lois Cross.
Present.
Kelly DeBell.
Present.
Mary Donaldson.
Present.
William Heisey. Emily Hubbard.
Here.
Hey, Emily.
Shanice Johnson.
Present.
Hey, Shanice. Long time no see.
Yvette Levy. Jennifer Orr. Albert Sanders.
Present.
Did you hear me say here? I'm sorry.
Okay, thank you. Andrew Vian. Doris Walker. So we do have 8.
Okay, 8. Okay, and let's see, approval of minutes of the last meeting, tab 1, Board of Trustees regular meeting, June 15th, 2026. Is there a motion to accept those minutes?
So moved. Shanice Johnson.
Is there a second? Is there a second?
Second.
Okay. it's
Do y'all
been
hear
moved-
me?
Yes,
Oh.
it's been moved and properly seconded. All in favor?
Aye.
Aye.
All opposed? Any abstentions? Okay, that passes. All right, reading of communications to the Board of Trustees. Sue, do we have anything? Presentations by interested parties, do we have anything? Okay, consent agenda approval of retirements and benefits, July and August 2026. Is there a motion to accept?
So moved. Shanice Johnson.
Is there a second?
Second, Mary.
Okay, it's been moved and properly seconded. All in favor by the sign of aye? Aye.
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 All opposed? Any abstentions? Okay, that motion passes. Next, we have approval of refunds and bills, June and July of 2026. Is there a motion to accept?
So moved. Shanice Johnson.
Is there a second?
Second.
Okay, all in favor by the sign of aye?
Aye.
Aye.
All opposed? Any abstentions? That passes as well. Unfinished business? So we don't have any. Report of the chairperson. Okay, I was pleased to be able to attend the MAPERS conference in Margaritaville, which used to be Tantera. This was an extremely informative conference. And we had several trustees to attend. Dr. Levy was there, Emily Hubbard, Dr. Candace Carter Oliver, myself, and is anybody I forgot, Emily?
Kelly was there.
I was there.
Oh, and Kelly, yeah, all right. I'm sorry, Kelly, I was, yeah. So, yeah, but we had a good time, and what I want to do is try to invite the presenter on AI because, you know, it's coming up fast, and it was very informative what he covered. And also, they had someone to talk in depth about data centers and the pros and cons. So I'm going to see if we can get one or two of those folks to come or get do a Zoom and talk to the board concerning those matters. I attended the funeral of Mary Armstrong, former president for 14 years of Local 420. And I brought condolences from the public school retirement system. A very nice crowd, and everybody was very appreciative. I have taken up on myself to go and to as many funerals as I can of our members and speak on behalf of the retirement system to the family, and it's worked out very well. Everybody's very appreciative of that. And I guess lastly, I was offered an opportunity to sit in on the insurance proposal from what was that Gallagher?
Yeah, they're gonna present.
Yeah,
tonight.
they're gonna present tonight, and I think you all will be very pleased with the work that Sue and her staff have done, and Monica have done to bring different products to our members. This is some of this stuff is historic, and I'm pretty sure the board members will be pleased at what is going to be offered today. So I'm done. If you all have any questions, anything I can answer. Otherwise, I'll move on to the next, and that'll be the report of the executive director, which is tab 4, Sue Kane.
All right, thank you, Mr. Chairperson. Appreciate that. I have just a couple of items. I wanted to point out that in your packet, there was a magnet that not be able to see it, but it should have been for those of you getting the mailed packet. This is a magnet that we just started this year. We worked with the Gallagher communications team to produce it. Thank you, Emily. Really just a way, we get a lot of family members that they don't know about us, and bad situations happen, difficult situations with family. So we thought this might be a way of, you know, having hopefully our information out and available. So how we're distributing this is we have special notifications that we send out to members. Starting at 90 years old, we communicate with them annually. So in those, what we call birthday letters, we're going to send a magnet. And then for new retirees now, we're going to include that magnet in their packet that they get. So hopefully that gives everybody a chance to look at, you know, and know our contact information. So appreciate Gallagher's help on this. And if anybody wants magnets, more magnets, we have them, you know, just let me know and we can distribute those. And again, if you didn't get it in your mailed packet, then, you know, please let me know if you are interested in getting some. I can send them to you. I also wanted to mention, you know, Chairperson Cross talked about the NCTR or the MAPERS conference. We have the NCTR annual conference that's coming up October 3rd through the 6th of October. And so anybody is interested in attending that. I've heard a few trustees that are interested, but if anybody's interested, please let me know as soon as you can. The venue, the hotel where it's being held at, they have a pretty tight turnaround on getting rooms reserved. So anybody can let me know, you know, maybe by the end of next week, if you're interested in attending, then I'll submit our registrations. We greatly appreciate. So I'm gonna toss it over to Diane and Mike. And Diane, you should be able, if you want to share your screen, you should be able to do that. All right. So we can see that, Diane. Thank you. And we can't hear you, Diane.
Can you hear me now?
Yes, we can.
All right. Good afternoon, everyone. Thank you for letting us come present. It's great to meet with you annually. So you've received this full presentation in your packet. So we're going to skip over some of the slides, but at your leisure, please go through the presentation. And if you have any questions, reach out to Susan and Monica, and they'll get us the questions and we'll answer them. And if you ever want us to come back and answer some questions, we can do that as well. But we really have a lot of ground to cover. So we're going to fast forward through a few of these things. So just stop us if you have questions. All right, the Gallagher team. As you know, there is actually two teams that work with Susan and Monica. We have the communications team and we have the consultant team. And I'm on the consultant side, and Mike is here also. He's on the consultant side, and he will be helping me present. On the communication side, I've mentioned this before, Erica and Tina have worked with Susan and Monica for a while. And Megan Miller joined their team this year. So there was 3 people on the communications team, and then me and Mike, and we work with Susan and Monica closely. Some communication projects that the communication team worked on this year. You just saw the magnets that Sue showed you. They also worked on the annual report, benefits guide, and a refund campaign postcard. So some of these are annually projects that they work on, and a few are different projects each year, depending on what the needs for Sue and Monica are. We'll adjust and try to work with them on whatever they need. Okay.
I'm going to jump in here. I'm just going to give you a quick review of last year's renewals. Like Susan said, there was no RFPs this year, but you'll see we had a few last year. So that's why we have a lot of things that are under rate guarantee. But I'll start at the top. The St. Louis Public Schools, their medical plan, the base and the buy-up, they end up renewing with United Healthcare and Express Scripts. And while we didn't make any changes to the plan design, there was about an average between the two plans of a 13.6% increase. I think that's down a couple points from the year before. I think the year before was like a 15% increase. So it went in the right direction, if nothing else. But as I said, no changes to the plan. So the folks had the plan that they were familiar with. And the medical side for the retiree side, last year we did conduct an RFP, request for proposal for the Medicare Advantage plans, and this was done in 2025 for plans that would take effect January 1st, 2026. And we end up staying with United. The rate was $30 for individual coverage, but that also included a rate cap for the 2027 renewal, which we will talk about that a little more in depth later, but that included a rate cap of $50 for 2027. And dental, we conducted an RFP for that as well. And after looking at different options, we decided to stay with Delta Dental of Missouri. They came in with a 3% increase in premium rates, and that was guaranteed for 3 years. So that went into effect January 1st of this year. I'm sorry, I am going googly eyed. That RFP was done in 2024. That went into effect 1/1/2025 for 3 years. The end result, it's still good through December 31st of next year. So there'll be no change there. And Vision RFP, this one was done in 2025. Once again, to take effect January 1st of this year. And we stayed with IMED. We'll get a 4-year rate guarantee. So it goes from 1/1/26 all the way through 12/31 of 29. No changes for 4 years. And we also got, in 2023, we got some extensions on a couple additional lines of voluntary coverage. One is the MetLife prepaid legal coverage. That rate is now guaranteed through December 31st of 2027. And the Allstate Identity Theft Protection Plan, that's now got a rate guarantee. That's good through 12/31/2029. So most of these, or all of these, are all locked up for this upcoming year. Those last two, the interesting thing too is we've seen as the years have gone by, we've seen the interest definitely kick up on those. A lot of people are seeing the benefit of those, and a lot more people have been enrolling in them. So that's all good. And as I said, we're all locked up for 2027 at the very least on every one of these plans.
Any questions about what's in place this year? Okay. Like I said, we're going to skip a few of these just because we have so much to get through. As Mike previously mentioned, last year when the St. Louis Public Schools retirement system elected to renew with United Healthcare, their bid included a decrease in rates from $50 down to $30 per month for either plan with a 2027 renewal cap at $50. We received and reviewed the original 2027 renewal and noted that there'll be only one mandated plan design change this year. Here's a side-by-side comparison of the coverage for 26 and 27. And you'll note that the only change, which is highlighted in blue, is the pharmacy out-of-pocket maximum. It is going from $2,100 in both plans for this year up to $2,400 in both plans for next year. So that's the only change that's going to be made this year. The original renewal also indicated a renewal rate increase from $30 back to $50, which was the agreed upon rate cap during the last year's bid. $30 to $50 is a 67% increase from the current $30. And to review what a rate cap means, it means that no matter how bad the group's experience is, they can't give you a rate that's higher than the cap. So $50. So even at the worst experience in the world, they couldn't give you, say, a $55 rate or a $60 rate. $50 was the cap. So the estimated total annual premium for 2026 based on stable enrollment, because we don't track the enrollment month to month, but just using the enrollment that you're seeing on the screen, 718 in the high plan, 832 in the low plan, estimated annual total cost for this plan is around $558,000. So with that increase to $50, that also increases the cost by $372,000 in 2027. So your estimated annual cost next year would be $930,000. And you can see that in the middle of the slide right there. United Healthcare, when asked why the increase was so much, they pointed to, there was a couple things that went on with Medicare. There's CMS claim trends around 7 to 9%, and then CMS had indicated increased funding of 2.5%, and as the main driver of their increase. So United Healthcare was concerned, and they claimed they were upping it, the full $20 to the max cap because of those two things. We didn't accept that. We pushed back because basically the supporting data was weak, and there was no evidence that they truly considered the renewal for next year. United Healthcare then did come back a second time with a flat renewal. So they went back to the $30. So they went $30 up to $50, back down to $30 for 2027. And they claimed that they cited that there was updated trend projections and a recent decrease in utilization. So, I mean, that's good news because the system will now save $372,000. They get a flat increase, so nobody will see an increase for 2027. We also want to add that we had gotten the renewal before this happened, but CMS just announced that the Medicare Part D Premium Stabilization Demonstration, which was created back in 2024 to aid the Medicare Part D insurers when they were adjusting for all those major changes in the Inflation Reduction Act. they decided to end it at the end of 2026. So this was a decision that was just came over a short while ago. So they're ending the bailout program. They say it's no longer needed. And they're saying that the result of this will reduce the pressure from renewal increases. So maybe United Healthcare had a hint of it. I don't know, but we got it back to $30. So we're happy with that.
I have a
Any
question.
questions?
I have a question. Can you go back one slide?
Sure.
On the low plan, you said the blue was the only thing that changed.
Yes.
Can you explain the tier 1, tier 2, and tier 3? Oh, I see. Never mind. I'm looking at the.
Okay,
Like in
so
the-
yeah, the different plans have the different tier levels. So if you take the high plan, you get a certain tier, and if you take the low plan, you get a different tier.
I was looking at the wrong way, and then I was looking at it. I was comparing the two different. Never mind. Don't worry about that part. CMS. Can you tell me what CMS is?
That's basically your Medicare.
Okay.
So when you retire, you get Medicare. So CMS governs, and they work and they make all these changes.
So that's a company.
Yeah. Well, it's the government. It's the good old government.
Okay. What does it stand for?
CMS,
Yes.
Centers of Medicare, and I don't know the last one. Sorry, system.
All right. No, that's.
I'm
Centers
too
for
busy.
Medicare and Medicaid Services.
There you go. Services. I'm sorry. I said system. So yeah, I'm sorry. When we get tied up with these acronyms, please stop us and ask, okay? Because I know Sue caught me a couple times. I put acronyms all over the place. So please, is he like CMS? I didn't even think to stop and explain. I apologize.
I had to cheat and look it up too just now. So
Thank you.
Okay, so also what we usually do around this time of year is we reach out to the St. Louis Public Schools, and they have a broker, USI, and we usually reach out to both of them, just trying to figure out, what is the renewal going to be next year, what's going on. And for the past couple of years, they've been pretty late because, trying to come up with the rate and everything. This year we've gotten absolutely nothing. They're not even giving us an estimate. They're not going to provide us with any information at all. And as a matter of fact, like Sue said, we have done some research, and they also didn't cooperate in that. But I do understand from Sue that there is going to be a meeting later this month with St. Louis Public Schools to discuss. Because not providing us information doesn't help us when we're trying to help you budget for next year. So we have no idea what's going on that end at this point. So we just made this statement on here so that you are aware that nothing was being communicated to us. We have reached out a number of times, and they're absolutely not even giving us the time of day this year. So not sure what's going on, but hopefully Susan will figure that out. All right. So as Mike mentioned earlier, we did go out to bid last year for the vision, and the system did renew with IMED. And there were a couple of concerns, a couple of issues. So what we're doing now is we're having monthly check-ins with IMED to ensure that there's no issues. And if there are, we discuss the services, how things are going. If there's issues, how can we, make them better? And I'll tell you, IMED has just stepped up to the plate. I mean, it's great what they're doing. So this comparison right here reflects the current services and benefits for the IMED Vision program. Recently, we reviewed the program's utilization during one of our check-ins, and our conversation gravitated to and then centered around retinal imaging. You'll note at the bottom of the comparison that retinal imaging services are available, and the member share is incurred could be possibly up to $39. You see, it says retinal imaging at the bottom, up to $39. So depending on where you're going, you might not get charged the full $39, but for all intents and purposes, we'll say it costs the member $39 cost share at this point.
Diane,
Yes.
could you kind of elaborate on some of the benefits of the retina imaging and how it can detect different diseases and so forth?
Absolutely. So some of you are probably wondering what is retinal imaging. So we put it on the screen right here. Retinal imaging is basically, it's like a camera. When you look into it, it's actually, you're going to see a snapshot like a flash. It is actually taken, it's a high resolution image of the back of your eye. So it's basically a picture of your eye health. And it detects a lot of things. It can detect symptoms before they even appear. Things like the glaucoma, the cataracts, the macular degeneration, diabetic eye disease. If you have high blood pressure, it can identify all of these things. So what it is, it's a permanent image. It's technology at its best. Takes a picture, they put it in your folder. Next year you come back, they'll do the same thing. And then they take the two images and they put them next to each other, and they can see like what has changed, and they can identify things and they can catch them. So again, technology, it's amazing. And this is the population that is recommended to get the retinal imaging, although anybody can get it, and it's probably a good idea for anybody to get it. But if you're 50 or older, if you have diabetes, high blood pressure, if you have any family history of eye disease, or even if you've just noticed changes in visions, like how you can read or you can't read all of a sudden, and it's just more comprehensive. As it states down here, research shows that retinal imaging captures up to 5 times more of the eye than a traditional eye exam alone. So you can imagine with the technology of the imaging and then comparison, what they can find out just from that picture. So again, so when we're talking about retinal imaging and what we'd like you to consider, we consider this a preventive enhancement, because that's exactly what it is. It's going to provide its early detection of something that could be going on that you don't even know about. And one of the reasons why we gravitated to this is because we did look at the utilization data. There was about 227 services that were retinal imaging services. And from those services, like when they send in the claims, there are procedure codes, diagnoses, and that go with these claims. And 76 services identified cataracts, 23 identified diabetes-related findings, 20 showed glaucoma. Also, what they also do with these is when they get the information and they farm it, anybody that's at high risk, they'll actually send them a notice. So a notice went out to 40 members, and of those 40 members that were notified, 6 came back and had additional eye care. So it's great. IMED is on top of it. They're doing a great job. It's really, again, it's a preventive enhancement. And what does this mean? Because, we're giving you all the information, but there is an impact to the cost. So we explained originally that the service is there. You can get it today. I think our friend here got it the other day, and he can tell us how it was. And there is a little bit of a cost impact, but so it could cost you up to $39. And this is in addition to just your copay for your office visit. So up top, what we did is we laid out the cost. So the current cost is $258 for retiree only, $513 for retiree plus spouse, and $771 for retiree plus family. Our understanding is that the system pays the first $3.15 of the program. So a retiree only is not paying anything if they've got retiree only IMED coverage. Retiree plus spouse would be paying $1.98, and the retiree plus family would be paying $4.56. So there's 2 options that IMED came back with. The first option would be, let's change that $39 charge and just have the plan covered in full. So the member could have it done. It's not going to cost the member any more than just having their copay for their visit or whatever else they have. So it would go from $258 to $281 for a retiree only. So that's an increase of 23 cents. You can see that the system would pay for it. So there's no change to the retiree in that instance if you were to change the cost share to pay it in full. For retiree plus spouse, the difference would be 46 cents. So that 46 cents increase would be passed along to the retiree. But when you think it'd go from $1.98 up to $2.44, not a bad deal. For retiree plus family, it would go up 69 cents a month. So $4.56 to $5.25. And the next option would be, so it's not paid in full, not paying $39. What if they just paid a copay of $19? So that's like middle ground. That's like right in the middle. Pay a $19 copay. So the impact would be it would go up half. So retiree only plan cost would go up 12 cents a month. And again, the system would pay that because it's under the 315. Retiree plus spouse would go up to 23 cents. So that would be passed along to the retiree. And then the retiree plus family would go up 35 cents, which would be passed along. So we did mention what was passed on to the retiree. There also, as you can tell, is a slight increase to the system. So we kind of noted that over to the right, just so you could see. So if you decided to elect to move to have the plan pay for this service in full, then option A would be an impact of about $6,100 annually to the system. That's an increased cost to the system. So it's really not that much. And then B would be an increase of $3,100. So half of that. Are there any questions? So we will list this in the recommendations for consideration.
And we do have to just offer one option.
Yes, you can only pick one.
Yeah, either keep it the same, change it to be fully covered, or have that $19 copay. It's be one of those.
Okay. So I won't spend a lot of time. There's a few slides here that I think Sue already showed you at the last meeting. So I won't spend a lot of time, but it's just more of a refresher. They came to us earlier this year, Monica and her, they've been getting a lot of requests, how can they get life insurance? What about long-term care insurance? What's available? What can you get? The system currently offers medical and dental and vision and then some voluntary products. So what can we find for the retirees now that will help them in these areas? Your life insurance would be basically, your final expense coverage. Long-term care, that's coverage, that's additional coverage necessitated when you get a chronic illness or when you're no longer able to complete at least 2 of the 6 activities of daily living. What I mean by that is things like, being able to bathe yourself, dress yourself, eat, transfer from the bed to the chair to the, to wherever, toilet and continence. If you can't be able to do certain things like that, that's where, like, if you have long-term care, things like that, you would get benefits and coverage and be able to have help, aid in doing stuff like that. So what we did was, the first thing we did was went to the state of Missouri laws, because we want to make sure that whatever the system offers, it's legal, they can offer it, what can't they offer, what can't they do? So very important. The coverage must be 100% voluntary, must be retiree paid benefits. The system can only act as a facilitator, which means, they can say, hey, you can contact so-and-so, but they wouldn't get involved in like billing or deductions or helping people sign up or, claims or anything like that. And there's no use of system funds. Materials that would be provided would be for educational in nature. They're not like, it's not sales driven or anything. They would want to clearly state that these are not specifically system retirement benefits. that it's just that, it's just they're providing some resources for people to be able to get this sort of coverage. So there'd be like no endorsement language. There might be disclaimers on the materials. And as always, we would want the board to retain the right to terminate a program if they didn't think it was working. So again, no financial exposure, no involvement from the system. The carriers would administer 100% of the retiree plans, the billing, the claims, the questions, everything. All that, Monica might do is give them, a name, a phone number or whatever, and they can call and get additional information. So when we started exploring, we started with group products because that's what we would think of when we would think of, an offering from the system. It'd be a group style product, maybe limited offerings, just to keep everything kind of closely knit so it doesn't go, out of bounds. So trying to find some point solutions. So we went to a number of carriers. You can see the list of the carriers that we went to get information. What we did was we packaged up an exploratory package and sent it out all to the carriers, had them review it and respond, and try to start a conversation. You'll see that most of the carriers declined to quote due to risk profile. So DTQ, declined to quote. That's a common acronym that's used. Risk profile. What we mean by that is because we are solely looking for coverage for retirees. There's no active younger employee population that's going to offset the experience. And because of that, you're only looking at retirees, you're only looking at an older population. The range went up to 102 years old. There's nobody that's willing to cover that type of risk because basically the losses are going to start pretty quickly. With long-term care, we could not even get Northwest Mutual or Thrivent to respond. And those are like the two top long care providers, the best long-term coverage. So we kind of had to evolve what we were looking for. Mutual of Omaha had some concerns, but they were open to discussions, and we actually did get further with them, and we'll show you some information shortly. A couple of other resources besides the carriers, we went to AARP because, as you know, that is highly popular with the older population. And, AARP does, if you're looking through the materials, you'll see that it offers New York Life. It offers LTD coverage. They offer all sorts of stuff. So we thought it'd be great to partner with AARP. So we reached out, but, understandably, they really can't provide. They came back to us and said, we can't provide just like specific presentations, webinars from like New York Life and that, because we can't make it look like we're promoting certain things. That it's just not part of their policy. What they did do, though, is they referred us to what was called AARP Missouri Speakers Bureau, and there's one in St. Louis. But when we looked it up, they had mostly general speaking type of topics. So they would come and talk to the retirees, but it's not things like we're looking for, like life insurance or long term. It was more like understanding your Social Security 101. Preparing for care, your Medicare 101, understanding your Medicare benefits, stuff like that. But interestingly enough, New York Life, we reached out to New York Life, and then also because New York Life was part of AARP, we went to AARP. But we got nothing we reached out to St. Louis Public Schools, we reached out to USI, we reached out to New York Life. We did initially get some information. St. Louis Public Schools offers it. We did see it in their benefits guide. We did find out that New York Life is offered to active St. Louis Public School employees. There are some riders. There's conversion rider. There's portability riders. What we were looking to see is, even if we could not find something, if we went back to St. Louis Public Schools and maybe we talk to New York Life. We could get them to offer, webinars a couple times a year to employees that are getting ready to retire, so they know about these benefits. They're clear, because maybe they're not seeing them, maybe they're not hearing about them, so that they could get them and they could keep their life insurance when they retire. We also asked for maybe language that we could put into the systems benefit guide, because as you know, our communications team helps Sue and Monica with the benefits guide every year. We're thinking, hey, what if we take some of the St. Louis public schools, because they offer the New York Life and they have some of these riders, maybe we can take some of that language, put it in the benefits guide, so that even if the people retire, they'll get the booklet. They'll say, oh yeah, I had this. And I know that there's a time frame, although I wasn't given the specifics, that they can actually go back and say, hey, I want to port this. I don't know if it's 6 months or whatever it is, but just see if we get New York Life to work with the retirees a little bit more, maybe, again, some extra webinars or something that, they could go to, they could listen online, maybe some materials that Sue and Monica could send out. But we were not able to get any engagement from St. Louis Public Schools or USI. But again, Sue is going to meet with St. Louis Public Schools. So hopefully later this month, maybe they can explain to them what they're looking for, and maybe we'll get some help on that end. But we couldn't get much further on New York Life. So we had mentioned that we were talking to Mutual of Omaha. There are individual products that Mutual of Omaha will offer. And we even had some representatives, 3 representatives got on a meeting and spoke with Monica and Susan, just explaining like what the products are, what they're like, what what retirees might be able to get. So this is just a very high level, because retirees, most of the time, a lot of the rates and cost is going to depend on how old they are, what gender they are, geographically where they live, are they healthy? So there's so much that goes into these. But if Mutual of Omaha does offer individual coverage, what might the retirees be able to call them and talk about? The whole life plan is the most popular with retirees. Coverage is usually $20,000 or less. It's permanent coverage, so they get it and they keep it. It's not like term coverage where it's only applicable for like 5-10 years. So if you're able to enroll and pay for it, you keep it until you pass. It's called final expense planning because the face amount is on the lower end. Your maximum issue age. So if you're healthy, you can be 85 and get life insurance still. So that's phenomenal. If you're less healthy, 80. What less healthy means, the retired really have to call, and if they had a couple of issues, it's still worth calling. It's still worth asking them and seeing if they can get something. The second type of plan is a universal life plan, very similar to the whole life plan. The face amounts are a little bit larger on this end. So it's called Final Expense Planning Plus. Again, it's permanent coverage, so it'll stay in effect till the person passes. It's the second most popular with retirees. For this one, though, you have to be fairly healthy. So the best bet is the whole life. The second option would be the universal life. The third type of plan would be a term life plan. And I did add this on because I still think it's important. It's not really popular for retirees, but you do have some early retirees. I did see some early retirees on the census, and they may gravitate more toward this. Higher coverage amounts, final expense plan and plus. It is a temporary coverage though, term life, 5, 10, 20 years. And in certain age brackets, it does reduce and it does eventually go away. And with this, it is limited eligibility. So whether you'd have to have a physical, you'd have to report, certain, health data. There are requirements that you have to go through for something like this. But if we're just talking life insurance, Mutual of Omaha does have some individual products. Susan and Monica could, if somebody calls up, they could use it as a resource and say, hey, you can call Mutual of Omaha. these are the types of plans they have. Give them a call, see what they can do. Does anybody have any questions on this? Okay, and the other piece, again, Mutual of Omaha, they also have individual long-term care. Again, very individual because I mean, geographic location, the cost of a facility care, cost of anything, it changes based on your geographic. So geographic, age, gender, health, everything. So it's really rate specific to the individual. We do have some sample rates, which we'll show you in a second, but individual long-term care, again, I kind of defined it earlier. So it's when you become chronically ill, and practitioner submits a plan of care, which shows that you can't complete at least 2 of the 6 activities of daily living. Then your individual long-term coverage would go into effect. Okay. The most popular plan they have is what's called Mutual Care Secure Solution. And these are the primary benefits of the plan. There is a cash benefit, which means that if you're getting certain services, sometimes, they'll give you a cash benefit that you pay out for those services. There's the home health care, the care coordination, facility care, respite care, alternative care, waiver of premium, international benefit. International benefit is interesting because you could get coverage even if you're out of the country for up to 12 months. It's really amazing. Hospice care. Also, there's an asterisk next to these, and the asterisk means that there's no elimination period to satisfy before you're eligible for these benefits. So, it's definitely something that's worth looking into. And by the way, these are primary benefits, but you can get riders. There's riders. You can get inflation protection. You can get shared care. You can get added security benefit. You can get reduced benefits for home health care and assisted living. So there's a lot that can be even added to this. So these are basic. This is your basic long-term, but you can add some things to it. Any questions on the long-term care? Okay. All right. So I said we'd show you some rates. Just please be aware that these are just sampling of rates. Monica and Susan wanted to kind of see how affordable could this really be. So we just asked for, a couple ages, couple genders, couple levels, so for whole life sample premiums and then your long-term care premiums. And again, these are in your booklet, so you can spend some more time on them. But again, it would change based on your health, your geographic location, other things, and any options you want to add, any riders or anything. But the rates, they do look pretty affordable, so not too scary. Okay, we're going to skip over some of this stuff. You have it in your booklet. So in summary, we are recommending renewal of the United Healthcare Medicare Advantage Plan, the Delta Dental and Missouri Dental Plan, the Allstate Identity Theft Program, and MetLife Prepaid Legal Program with no rate or plan design changes. Again, the one exception is the United Healthcare Medicare Advantage Plan, which has that one mandated change to the pharmacy out-of-pocket maximum from $2,126 to $2,400 next year. We're also recommending renewal of the iMed Vision Plan with consideration of 2 preventive health enhancements to the Retinal Imaging Services member cost share. And lastly, we're recommending consideration of offering Mutual of Omaha as a resource for retirees to reach out to and inquire about voluntary individual life and long-term care coverages. Any questions?
This is Shanice. I had a quick question about the retinol. We
Sure.
don't know the utilization. of the retirees for getting it out of pocket, do we, like we know with the dental services and other
Well,
services?
we do know that in 2025, there was 227 services for the retinal imaging. So we can assume that they paid that up to $39. They may have not paid the full $39, but some portion of that. I would almost think that most likely it was the $39. Louis, did you get a charge?
They said it would be $39 or less. They would get back with me because they hadn't really used it that much for SLP, PSRS. But they were very excited about the possibility that, we're gonna spread this information around. I said, well, I'm pretty sure you'll be getting possibly a lot more of our members to utilize that service.
Thank you. Yes, it's a very important scan. I just wanted to make sure that we knew the utilization because that is important, really important. Thank you.
I didn't know we had it last year, but I know now.
Any other questions?
I guess my question would be based on the retinal scan. Do we know about, I know it goes probably in and out, but about how many people actually, if we choose the option to pick up the retinal scan for everybody, how many people are actually going to the eye doctor yearly or using the iMed insurance?
Monica, do you have the total was there total utilization on there somewhere?
So, well, the 227 members they all had high-risk diagnosis. And they were all mailed postcards from IMED giving them a heads up of, they need to contact their doctor. But are you asking how many people have?
How many
IMED
people are
insurance?
using iMed?
Yeah, actually using it because if we only got 200, we have more than 227, but if it's not that
Oh
many.
yeah, no, we have
2,573 members as of August 2026 is how many people we have in it.
Okay.
Yeah.
And am I right that we had that imaging in our packet last year as well? Is that right, Diane?
yes.
And the utilization of a packet last year, did it increase or did it decrease? Monica?
We did get a slight increase in the rate last year, but it was not the benefit. It was I don't think I have I don't have my last year's presentation in front of me.
I think it was somewhere around 6 to 8%, somewhere in there.
Yeah, and it's good for 4 years, so.
Okay.
Yeah, and I don't know if we have the utilization. We haven't had the report from well, we had that meeting earlier this year. Do we have that number of how many eye exams that we've had?
And I guess it's just something I would want to make. I mean, we want to take care of our retirees, but it's got to make sure it benefits the system as well to include the eye imaging. Because I get the last 3 times I've been, I get the retinal screening. Last 2 times I've been, I get the retinal screening. So I know how important it is. I just want to make sure it makes sense for us to provide a service if only the ones who get the message from IMED are using the retinal service.
Robert, to your point, if I can piggyback off of that, if we make a decision to include it, either option this year, because we are locked in with IMED through, I believe, 2029, if we want to say we're going to do the $19 copay this time, but we see the utilization has gone up tremendously, could we change it next year to be full coverage out of curiosity?
Yeah, you could change it next year. Whoops. Actually, let me see if I can, because I'm sharing it here. Utilization, subscribers.
Yeah, there you go. Exam utilization.
Mhm.
Yep, 17%. Glasses, 95.3%. Lenses. Utilization in network, 98. And I think this year, this is 2025. And I know there was some miscommunications in 2025. And we have changed the literature. IMED is sending out like where to go to go to the plus places, so I would anticipate utilization for 2026 is going to spike.
Right. And
Monica's shaking her head too. I absolutely, with everything that IMED has done, I can see 2026 spiking above what we're looking at here for 24 and 25.
right, because 17% of the retirees are taking advantage of eye exams yearly right now. And
Yeah.
this is just me asking, does that the benefit of covering the full cover providing full coverage, is that a for again, 17% is still the most important 17% that go get it. There are retirees who got to take care of them. But if it's only 17%, 83% are not using it. Do we provide the full retinal exam in hopes that it benefits the system or the retirees most importantly, but also the system, or do we wait and see if the utilization goes up because of my IMED's updated policies or whatever, and then we come back to you next year, we go back next year and say we should provide this for everyone because now we have 50% of our users, 40% of our users going and they're getting the eye exam. I hope I'm making sense.
You are. Can I just mention something? Previously, they would not mail cards to our members, and there were a lot of people that didn't have a card. They didn't know the name of the insurance company, and there was a lot of confusion. And we fought and advocated for a change to that. And IMED came back and said, okay, we'll mail cards to everybody, and we'll also put at least 8 locations around their home address. That's what they implemented this year so that people can actually physically see this is our insurance and we want to be able to use it. That's why we think there's probably going to be a spike this year,
And that's good.
if that helps.
Yeah, I would anticipate utilization doubling this year because of everything that they've done.
Yeah.
So am I understanding this correctly? I just want to make sure our utilization is only 17%. So that means down on the right, 515 members are the ones, that actually got an exam, and 98.3% of those people were using in-network providers. Am I reading all of that correctly?
Yes.
Okay.
Yeah. So
Yeah.
I think we'll see that exam number double this year.
Right.
And I think to,
Listen,
I was just gonna say, to Monica's point, before we got the ID cards mailed, anybody that had Medicare Advantage with us, or really any coverage anywhere, there is coverage there for eye exams, materials, things like that. And a lot of times when you go in to the eye doctor, they're gonna say, give me your medical card. So I think a lot of the claims prior to this year were probably going under the Medicare Advantage plan. So I think we had more utilization for exam, but it was under the Medicare Advantage plans. Sorry.
Yeah, that just 17% seems really low to me.
does.
So that's why I was asking.
Because I just want to say that I didn't know that we even had it last year. And so that's why I anticipate, along with what Sue just shared, I anticipate a large spike in the utilization of it, especially when they find out all the attributes of having this retinal imaging done and how it could detect diseases and so forth ahead of time. So I think maybe some of the numbers are skewed a little bit because it was under a different plan. But also, like in my case, it was because I didn't know we had it. And luckily I was in that meeting, and then I went out that same day and got it. And I'm better for it. And the doctor pointed out some of the things on it. And so that I'm going to make sure that we share that at the retirement meetings that we have in each one to make sure that people are aware of it.
And I agree. I mean, I agree, but people were, and this is just me being truthful, people were aware that they had eye coverage and only 17% still used it. 83% they used it.
That's not necessarily true.
According to,
I know, but Sue said because of what, there were some people who possibly utilized it, but it was under a different heading. And so therefore those percentages not added in. So
but
that you can't
our
keep
pa-
saying 17% and kind of
the 17% is
hanging
what
on
you,
that number.
what
when
you
there
present
were
to, what
possibly
you,
other people that utilized it that were not counted, is what I'm trying
what
to
you
say.
present to the board is the numbers that they had. We can assume everything we
No, we're
want to
not
assume.
assuming. She said it was under another heading. It's not an assumption.
Yeah, but I mean, we don't know for sure what
Right.
that number is. We
Right.
know what the number is with IMED.
Right.
That's what I'm talking about. And that's what we would be, and that's what we would be increasing, possibly increasing our benefit for the retinal thing is what IMED provides for 17%. Is that the better put it that way? What we are trying to provide for our retirees, which is very important. Like I said, like 7 times, but we're providing it for the 17% who utilize IMED. And that's just the facts that utilize IMED. So I'm just making a cost benefit for the system. At the same time, we want to take care of our retirees, but if it's cost beneficial for the system.
I get your point, Albert. And so with this being my committee, I'm just curious of the other committee members, did you all have a recommendation on which one we should do, or which one you would recommend us do is a better way to say that. Anybody on the committee have
This is Emily.
Mm-hmm.
My grandpa had macular degeneration, and but my insurance doesn't cover the scans. And so but they tell you the insurance won't cover it. And so sometimes I get it and sometimes I don't. But if I were to hear the system covers half of it, I would get it every year and I would know more about what's going on with my whole body, not just my eyes. So I don't know what proportion of the system the expense $6,000 would be versus $3,000, but I would do it for everybody because especially for an aging population, that's so important. If once you lose your sight, a lot of other things go with it.
So your recommendation was the plan pay in full, not the $19 copay.
I would be glad to do either, but
it's okay.
But yeah, I would just pay for it.
Okay, that's why I wanted to know because I wasn't able to attend the meeting, so that's why I'm asking. Sorry to put you on the spot like that.
No, it's fine. Yeah,
thank you. I got you.
I want everybody just to be able to get it without worrying about is that gonna, be less food at the grocery store, that kind of stuff.
Got it. Thank you. Those are all my questions.
Sue, do you want us to move on to the motions?
Yeah, we can.
Oh, wait a minute. Hey, one more spot here. Hold on. Come on. There we go. Mike?
Yes. Well, this is just a reminder of the open enrollment meetings. They will, as in years past, there will be live webinars. And as you can see, there's 2 dates scheduled: Thursday, November 5th from 2 to 3:30, as well as Tuesday, November 10th from 10 to 11:30. And like in the past, there will be account managers from the various insurance carriers on hand to also answer questions and to help people out with any questions they may have. So just want to put those dates out there to remind you to have those on your calendar.
And we kind of group the motions for approval. Sue, do you usually state them or do you want me to read them?
Well,
The committee will, I got it, so.
yeah.
Okay, thank you.
Oh, no problem, no problem. So, I move to approve the renewal of the following for 2027 with no change of premiums or plan designs as recommended by the insurance consultant. That's the UHC Medicare Advantage plan, other than the pharmacy out-of-pocket maximum change. Delta Dental of Missouri Dental Plan, MetLife Prepaid Legal Voluntary Benefit Program, Allstate Identity Theft Protection Voluntary Benefit Program, and St. Louis Public Schools United Healthcare PPO plans with Express Scripts prescription, contingent on Board of Education approval.
Second.
Okay, it's been moved and properly seconded. Do we have any discussion or any concerns? Do we have any questions or concerns? Last time, do we have any questions or concerns? Okay, we'll do a roll call vote.
Candace Carter Oliver,
Yes.
Louis Cross.
Yes.
Kelly Dobell,
Kelly, are you there?
Yeah, I was trying to unmute. Yes, I'm sorry.
Mary Donaldson,
Present.
Are
Finally back in.
you voting yes or no, Mary?
Yes, I'm sorry. Yes.
That's okay.
Emily Hubbard,
Yes.
Shanice Johnson,
Yes.
Yvette Levy,
Yes.
Jennifer Orr, also, Jennifer's also on mute.
Jennifer, are you all, can you hear us? You might be away from her.
Okay.
Big
Albert Sanders,
Yes.
all right, so we have. And Jennifer, are you there? Well, we do have 8,
Okay.
so the motion carries.
Yes, I'm here. Yes. I'm so sorry.
You vote yes or no?
Yes.
Okay. All right. So it passed with 9 votes?
As 9.
Okay.
All right, I'm gonna attempt to modify this second one a bit. I move to approve renewing with IMED at the same rates and plan design to include amending the service to a $19 copay for retinal imaging. And we need to revisit this next year to base our next decision on the utilization to determine if we keep it at $19 copay or full coverage.
Right.
I hope that makes sense. Do I need to repeat it?
Do you all need it to be repeated or did everybody understand it? If so, then I need a second.
Second.
Okay, any discussion now? Or
Yes,
questions?
because I did not quite understand. I was trying to get in before the second. My apologies.
Okay,
Can't-
go ahead, Shanice.
So my recommendation is that we amend the plan to include the retinal imaging with the $19 copay. But once we do get the numbers in for the utilization, we want to bring it back to the committee and then ultimately to the board to determine if full coverage is necessary if it's being utilized. So just trying to be prudent with the dollars in case the utilization rate isn't what we're thinking it's going to be.
Any other questions, Dr. Levy? Dr. Levy, did that answer your questions?
I'm sorry. Yes, I thought I was out off of mute. So what then is the utilization amount that we want to see? So, because it's 17 now, and if it's 20, is that the number? Is 30 the number? Is 50 the number?
Well, for me, it's not arbitrary, but because we don't have complete information about the retinal piece, period, because it's not covered, then we
Right.
don't have anything to base it on. That's why I was recommending a tiered approach.
Got it.
So to me, is at this point, we just think it's 17%, but it could be really zero that did the retinal scan. We don't know that, but we should know more after this.
And one of the things that I felt was very necessary is to let people know it's there and what it does, because I think, like in my case, I didn't know it was there, and then I happened to be here and hear about it, and definitely I would love that because it can detect diseases of the eye and other things that in the past you just kind of lucked up on. Now you have some scientific support systems. So
Mr. Chairman, that was kind of my feeling, that we didn't have people who really knew
exactly.
what the benefits of this service are.
Exactly.
And so again, that I think if you don't know, you don't know.
Well, I'm hoping that we will get some information out at those retirement meetings and have someone come in and share exactly what it does. And for how much is it this time? $19?
$19.
19, because we also discussed in that presentation that if we do get a good response, because people now know about it, maybe next year and it's free, it'll really spike. It's always going to spike when it's free, you know. But that being said, I'm with you, Dr. Levy. I hope that we can let everybody know what's available, and that to me is a blessing in disguise.
And I think it's important. The education is so important because the eye doctor is the one who should be recommending it anyway. I mean, the eye, whoever's doing their eyes, Crown, personal eye doctors, because that's how I found out about it. You know, but we got to make sure that our retirees do know that to ask for it, not just to assume that somebody's going to do it for them. Because just even if it's free, even if it's free, doesn't mean they're going to use it. You know, but we got to make sure that they ask for it, because again, my optometrist just said, you know, we recommend you getting a retinal scan and put that thing up to your eyeball and real close and almost touch it. But that's what she said. And I was like, yeah, sure. You know, yes. So it's education, but also asking for it. Because I know as you get older, as we get older, we sometimes tend to shy away from asking for things. If it's $19, if it's free, or if it's $39, because we don't know much about it.
And to that point, Albert, I want to ask, even if it's 39, 19, or 0, the benefit is available, correct?
Yes.
Okay.
I think we're at any other questions now. Any more discussion?
Okay, so it's been moved and seconded. And so we're ready. Are there any questions, concerns, or comments? Questions, concerns, or comments? Any additional ones? Last time's questions, concerns, or comments? Okay, so we'll do a roll call. I'm sorry about that.
Candace Carter Oliver,
Yes.
Louis Cross,
Yes.
Kelly Dobell,
Yes.
Mary Donaldson,
Yes.
Emily Hubbard,
Yes.
Shanice Johnson,
Yes.
Yvette Levy,
Yes.
Jennifer Orr,
Yes.
Albert Sanders.
Abstain.
What we got?
So we
Have eight. Oh, incidentally, the number for the,
we'll talk about that.
okay, is it gonna be in the legal part? Okay, I'm sorry. Jumping the gun.
So we have eight, so that.
Eight, so it passed.
I got another one, Chairman.
Then another, I'm sorry, Shanice.
I
Go ahead.
took. I move to approve recommending Mutual of Omaha as a resource for retirees to inquire about individual life and long-term care coverage.
Second.
Okay, it's been moved and properly seconded. Are there any questions, comments, or concerns on this matter with Mutual of Omaha? Questions, comments, or concerns? Last time. Questions, comments, or concerns? Okay, we'll do a roll call on that one as well.
Candace Carter Oliver,
Yes.
Lewis Cross,
Yes.
Kelly Dobell,
Yes.
Mary Donaldson,
Yes.
Emily Hubbard,
Yes.
Shanice Johnson,
Yes.
Yvette Levy,
Yes.
Jennifer Orr,
Yes.
Albert Sanders.
Yes.
Okay, so we have nine.
We have nine, so it passes. Excellent job, Shanice and Emily and Mary. Excellent job. Thank you all so much. Okay,
Thank you to
and thank you to
Diane
and Diane, are they still here?
yeah.
Yeah.
Oh, there they are.
Monica, of
Okay,
course.
I'm sorry, and thank you all. I'm sorry. And it was very well presented, and I think all of the questions that we had have been answered. So, and Monica, as usual, thank you so much.
Mhm.
Thank you so much. Let's
And I
see.
had one other item.
And Sue, go
in
ahead,
the
Sue.
report. So
We're still on the executive director's report.
yeah, so also included in your packet was the information about our renewals for our business insurance. This time it is the crime and the liability or the fiduciary liability coverage. So I wanted to just go over that now because those policies expire in August 20th, so very
Close.
quickly coming up. So this is what was in the packet. The current coverage with travelers right now is what's expiring, and then we also have that's for crime, and then Encore does the fiduciary. So on the fiduciary, that's the easy one. Fiduciary coverage by Encore, they are willing to renew, no change in coverage, and the premium's actually even gonna stay the same. So that's been kind of a big one the last few years that often that premium goes up quite a bit. And that was due to a lot of claims that were out there related not necessarily to our type of plan, but to more defined contribution plans and things that were happening in that marketplace. But it impacted the whole market. That seems to have cooled off. So Encore is willing to renew the coverage, the limit that we have there, and then the retention or the deductible. So before we would have any claims, we'd have that claims paid, we'd have that $100,000 deductible. But the premium is not changing for this year. The one that is the little bit of an issue is the crime policy. And that crime policy is gonna cover, if there's any kind of fraud, whether it's internal or external, that's what the crime policy is going to cover. So we've had travelers for many, many years, but this year travelers declined to quote. And there really wasn't a whole lot of reason for that other than, market wide, they really are trying to get out of this business. So it wasn't anything specific to PSRS, but they are getting out of the business. And then we had them as the fiduciary provider and they got out of that last year. So this was, really kind of probably to be expected. So Gallagher different Gallagher than who we had present tonight, but our folks here that in St. Louis that take care of the business insurance, they gathered 2 additional quotes, and Encore and Great American is the 2 quotes that they received, and they are recommending Great American. Great American essentially is going to replicate what Travelers had with that, $15,000 deductible and the limit, but it's going to be a higher premium. So the premium, is going up. Dollar wise, it's not a huge amount, but percentage wise, it's a 65% increase. The other bid that they received, the other quote that they received is from Encore, who handles our fiduciary. There were a few items, cash moving in and off premises that they don't cover, and their premium was a little bit higher, and the deductible was a little bit higher as well. So Gallagher is recommending that we go with the Great American quote. Again, it would just be that premium would be a little higher with Great American. So questions on this? Again, these policies are good for a year. They are expiring August 20th. Any questions about that? And if there
You got 'em
are no questions, that motion is right there
at the bottom.
at the bottom.
Can I get someone to read the motion?
I make a motion to accept the renewal of the fiduciary coverage with Encore and the new crime policy from Great Americans as recommended by Gallagher.
Okay, is there a second?
Second,
I'm sorry, who was the second?
I think that was
Kelly.
Oh, that's
Oh,
Kelly.
or Emily.
All right, questions, comments, or concerns? Are there any questions, comments, or concerns? Last time, questions, comments, or concerns? Okay, then we'll take a roll call vote.
Candace Carter Oliver,
Yes.
Lois Cross.
Yes.
Kelly Dobell,
Yes.
Mary Donaldson,
Yes.
Emily Hubbard,
Yes.
Shanice Johnson,
Yes.
Yvette Levy,
Yes.
Jennifer Orr,
Yes.
Albert Sanders.
Yes.
So again, we have 9.
We have 9, it passed.
Thank you all, and that will conclude mine.
Okay. Moving on, report of the investment consultant, that'll be this Thursday, right?
Next
Thursday. The investment consultant will be next Thursday. Actuary, no report. Report of committees, benefits. You all have a report, or you have anything to add to what you've already done? Shanice and
No, I
Emily
don't
and
have
Mary.
I don't. No.
Real thankful for Gallagher and all the work they've done.
Okay, like I said, excellent job on you all's part. Thank you so much. Trustee business committee, is there a report? Okay,
There is actually,
there isn't a report. There is a report.
yeah, we do have the travel expense.
Okay.
All right.
I don't know if Ms. Orr had anything to comment on, or
What'd you say?
she would just like if Ms. Orr would have anything to comment, or
Oh,
if she
okay.
just wanted me to kind of review this.
Ms. Orr, did you have anything that you needed to interject into this report, or because Sue has some things that she wanted to add as well?
No, I didn't. No.
Okay. Okay.
Okay, so this is just the travel expenses, including registration fees for the Vapors Conference that we have received, and it was through August 5th. I believe I've gotten a few since then, so that'll be on the next report. We always have started doing this last few years as we receive them, and then at the end of the year, we'll just have the full everything together added, for travel expense. So this is, what has been submitted so far, for conferences. And then I'm sure we'll see more. And also as a reminder, if anybody has not submitted any, expenses, receipts, things like that, the travel voucher for any conferences you've attended, please get that in. But I think we're in pretty good shape. As
I
far
owe
as,
you one, but I'll do it this week.
yeah. Okay. Thank you.
Okay.
We make a motion or no? I make a motion that expenses submitted through August 5th, that these are the expenses submitted to August 5th to approve the 2026 travel and registration submitted through August 5th.
There's a second.
Second.
Okay. It's been moved and properly seconded. Do you have any questions, comments, or concerns? Questions, comments, or concerns? Last time, questions, comments, or concerns? Okay, we'll do a roll call.
Candace Carter Oliver,
Yes.
Lois Cross.
Yes.
Kelly Dobell,
Yes.
Mary Donaldson,
Yes.
Emily Hubbard,
Yes.
Shanice Johnson,
Yes.
Yvette Levy,
Yes.
Jennifer Orr,
Yes.
Albert Sanders.
Yes.
All right, so once again, we have 9.
9, it passes. Okay, where are we? Trustee business, investments, no. Investments will be next Thursday.
Well, I don't know if they have a report.
Okay,
No report.
okay,
Uh-oh.
thank you. All right, legislative rules and regulations. Is there a report?
So we do have that.
Hmm,
We do have that motion.
okay, we have a motion for that.
And I guess just as an update, maybe, well, Christine's getting that up for us, is the governor did sign the legislation that we talked about in June. He did sign that. And so the rules that we had a meeting on in June, and also oh, sorry, this is the one for the legislation. Okay, so I don't know about that. Yeah.
Quorum.
So we had some things that we talked about in June, and that is changing the quorum as well as the the quorum number, and then the co-chairs. So that is something that we were now we can approve, because the process is to discuss it, and then we talked about it at one board meeting, and now the second board meeting. And then now that the governor has signed it, we talked about that. It won't be effective. The legislation signed by the governor won't be effective until August 28th. But I think Dave and Christina advised that we could go ahead and talk about that. So, and vote on it at this meeting. So,
Yeah, we talked about this on a few occasions, so all we're doing now is approving the changes to those rules and regs. And we've been operating like that anyway. This was just a cleanup to the quorum and the voting procedures, and so we've been operating like that anyway, so we can go ahead and get those approved.
Okay. So where are we now, Dave? Just do a roll call?
I think, yeah, we can
Put the
get out the
motion up.
motion and have somebody make a motion,
Okay,
unless there are questions or comments.
did you all want to hear what those are again, or is everybody clear on what the actual things that the governor signed say? Everybody know about that? Okay, then we'll do a roll call vote.
well, we have to.
We gotta make a motion.
I'm sorry, gotta do
Yeah,
a
we have
motion
to
first.
start there first.
Okay, so we're waiting on the motion then.
Christina, do you have that one?
I think is it the one that we shared earlier?
I don't know, I don't know if we have the motion for the rules and regs.
I don't think we have that one.
Okay, you wanna cook up one?
I can do that really
Okay.
quick.
Dave is a master of cooking up stuff for us at the last
Mhm.
minute. Right, Dave?
Yeah, I've done it before. We can do it
sir.
now.
Sure have.
That wasn't on the list. I didn't see I mean, I knew we were gonna approve it. I just didn't know we needed to draft one.
Yeah.
Yeah, I thought you had volunteered Christina to do it, so apologies. Do we want to go to the next committee and then we can come back?
Yeah.
to
While you're doing that, Christina, we'll move on to the next committee and come back. Personnel and professional contracts. Is there a report?
Well, I don't know that there's a report other than, Susan, you said, or you sent out an email with a summary. Were you going to walk us through that summary tonight? Or what would you suggest?
Well, I think we just need to discuss, how we want to proceed, if we want to have a separate meeting to review that. I don't know, because again, it was sent out, I think, Friday, kind of late,
Yes.
so not sure
Can-
everybody's had a chance to review it, whether we want to.
Okay. Perhaps can you put the summary up for us to look at, and then we can determine whether we want to have a special meeting or have some discussion tonight?
Sure, we would probably best do that though in
Closed
closed session.
Oh, I see. Okay. Okay. Oh, okay.
We'll park it and do it in closed session. Is that okay?
Yes. Okay. Very good.
Thank you, Dr. Oliver.
And then there was an update on the other RFP also.
Do we want to do that in close as well, or?
I think that is just an update on, that we have had responses to the notice that was posted.
Okay.
You want to share that, or I can share that.
Yes. Do you mind putting that up?
Yeah, there's nothing really to put up.
Oh,
It's
I
just
see. Okay.
Yeah, it's just to mention that we have the investment consultant RFP out there. And we posted a notice on the, basically sent a notice out and then posted it on our website. And we've received 7 responses of
So far.
companies saying that they will respond. The deadline is Friday, August 21st. So we will have 7 responses, or hopefully have 7 proposals once we get closer to that deadline.
Okay.
So that one is in progress.
All right.
Thanks, Sue.
Yeah, thank you.
So I can go on to the next one, actuarial audit and RFP summary.
That's what we just talked.
Okay.
Yeah, we're gonna do
All
that
right.
in closed
In closed
as
session.
well.
All right.
And I guess, Dave and Christina, if we could, can we do that motion for the legislative rules in closed session as well? Or should we do that now?
It doesn't matter, either one. So we can wait.
So if that's the case, then maybe we can. We're gonna do that in closed session, then maybe we can move on then to the attorney's report.
Okay. All right, then we're gonna do that in closed session, right? Attorney's report.
Yeah.
So there's a motion coming up to go into closed session. So can I get someone to read that motion?
I'm sorry.
I'm sorry. I'm sorry. I'm thinking if they could see
Yeah,
it. but
they can't see it yet.
I need to slow down.
There it is.
Okay, who wants to be first?
I'll read it.
All right, thank you.
I make a motion to close the meeting and that all records and votes to the extent permitted by law pertaining to and or resulting from this closed meeting be closed under Missouri Revised Statute 610.021 and for the purpose of having a confidential or privileged communication with the legal counsel for the PSRS STL on legal matters.
Is there a second?
Second.
Questions, comments, or concerns about the going into closed session? Questions, comments, concerns? Last time, questions, comments, concerns? Okay, we'll do a roll call vote.
Candace Carter Oliver,
Yes.
Louis Cross.
Yes.
Kelly DeBell,
Yes.
Mary Donaldson,
Yes.
Emily Hubbard,
Yes.
Shanice Johnson,
Yes.
Yvette Levy,
Yes.
Jennifer Orr,
Yes.
Albert Sanders.
Yes.
So again, we have 9.
Okay,
All right,
motion
so
passes.
let me do just a few things.
I have something to share with you all. We'll just wait till we get back on.
I have something to share. Today was the first day back in the classroom. Off vacation.
I hope that they can do something to keep Adams open, because a lot of folks upset about that.
You should write a letter to the board on our behalf.
Oh, yeah, I probably will.
Please write us a letter.
Yeah, because I mean, the people, they've done such a good job of with that area down there, because you're in the Grove, right?
Yes, sir.
Yeah.
We take all letters on behalf of Adams Elementary School. You can send it to Emily and her friends. And Dr. Berry, but
Okay.
You're live.
Are we live?
Oh, sorry, let me turn the recording back on.
Okay. Okay, Shanice, I talked to Sue and she said you were interested in having a retreat, and I had also said the same thing. I think we have new members on the board. We have a larger board now, and so I wanted to get this going. And so could I get some volunteers from the committees to develop a retreat for the board?
I'll assist.
Did you say you would?
I said I'll assist.
Oh, okay, assist, and we're gonna need at least 3 or 4 people. Anybody else?
If I had Shanice's phone number, I would assist too, but I don't have her phone number.
I can get that for you.
Yes, I'm willing to support that effort.
Yes, I am too.
Okay, so who said that?
That was Levy.
Dr. Levy?
Yes.
Okay.
And
Was that Dr. Oliver on there too?
Dr. Sanders.
Oh, Dr. Sanders. We got too many doctors on here.
And Shanice.
We need one more though.
Shanice.
I think this is just me thinking like if a new board member, because we would know more of what they're looking for as well, not just people who, I mean, we're amazing, don't get us wrong, but they would also know we'll know what new board members in the future are looking for. So having somebody newer who would like to assist, is just an assist in the tree, I think would be valuable.
Do we have a person? Do we have anybody who's volunteer?
I'll assist. This is Candace.
All right, then. Dr. Oliver. Okay. So let's see. So then we'll get that done. The only thing is we can only meet 3 board members at a time, right?
Well, I think there have been retreats in the past, so I think we'll just work with
the 4.
with legal to make sure
Okay.
that, yeah,
All right.
we can work this out.
Okay. Yeah. So let's get that done. But I know we're gonna have to check everybody's schedules and all that stuff, but we need that so that we can all come together and be on the same page and understand what's going on and all those kind of good things. And I think the thing that I always like to promote is kindness. Everybody treat people with respect and kindness, and I think we get along very well. In fact, Emily has said some nice things about us all the time about our meetings. So I look forward to you all getting it together, and I look forward to. When I first joined the board in 2005, when I was 13. We had a retreat in Warrant, right? Was it Wright City or Warrant? Where they have what's the name of that place up there?
What,
Innsbruck, yeah. We had a retreat there. And that's Christina and I, we were there, and that's where I met her. So it can be off campus or whatever, but we just need to be away and like on the weekend or something. Well, definitely
So
on the weekend.
are we targeting 2026 or is this a 2027 endeavor?
I think that would be what you want, whatever you all come up with, as long as you consult with all of the board members, so they all have some say so in what we do.
Is anybody term ending in 27?
Mine ends this year, I think.
That's correct. She's.
What you say?
My
Okay,
term ends in December, so that's kind of sort of why I'm asking the question.
yeah, well,
So I say we should target 2026 if at all possible.
Thank
okay,
you.
get everybody that's here now. Okay, that's great.
Absolutely.
Okay, well, that's good. Because I had been thinking that way for a long time. I talked to Christina, same thing, because we're kind of the older ones on the board now, because we've been here off and on a long time.
Literally and figuratively.
Okay, I know it's after 7 o'clock.
I make a motion to end our meeting today, August 10th. It is 7:05 p.m. It is all right, Chairman.
All right, sounds good. Is there a second?
Second,
All
Shanice.
in favor?
Aye.
All right, thank you all so much for your time, and let's get that retreat going, and maybe we'll even get some nice, delicious food.
Hey, Chairman Cross, this is Levy. When this is over, can you give me a call, please?
Sure, yes, ma'am, I will.
Thank you.
Okay.
Have a great school
Night,
year
everybody.
to all my people who are getting these kids in 2 weeks and everybody else in the education system, which is all of us.
And don't forget to get your eyeballs checked.
Thank you.
Okay, bye-bye.
Bye-bye.